Hi there, I'm Dr. Dominic from Let's Get Checked, and I'm here today to talk to you about fertility in women in particular. So why are we making this video? Well, every single day I and our team of nurses in Let's Get Checked get questions about fertility, what hormone profiles they should order from us, and general anxiety and concerns about fertility. There's also a great deal more awareness about fertility issues in the media, on social media and general media. And one statistic that's commonly used is that 1 in 6 couples will experience some difficulty in conceiving at some point in their life. So that's another reason to make this video today. So I'm going to talk about general headings in terms of what increases your risk of having difficulty conceiving or having fertility problems in women. So the number one thing is unfortunately age. Number 2 is extremes of weight. Number 3 would be pelvic inflammatory disease. Number 4 would be lifestyle factors, and number 5 would be genetic factors. So I'm going to go in more depth into all of those topics now. As I spoke about, the number one cause of a reduced fertility is a woman's age. We know that over the age of 35, about 25% of women will experience difficulty conceiving. So really, once you hit 30, your ability to conceive does drop off considerably, unfortunately. The second common reason for experiencing infertility would be any extremes of weight. So women who are very overweight have a reduction in estrogen production, and women who are very underweight have a reduction in estrogen production. And that's similar to other videos that we've spoken about in terms of hormone imbalances. So extremes of weight are if you're too thin or your BMI is too high or too overweight, you may experience difficulty for conceiving. The third condition that can very commonly lead to problems conceiving is a condition called pelvic inflammatory disease, or PID. Now, we have spoken about PID in a video separately. If you want to look that up, it's very informative. But pelvic inflammatory disease is basically caused by untreated sexually transmitted infections. And the most common causes of those would be chlamydia or gonorrhea. So again, untreated STIs can cause pelvic inflammatory disease. The fourth common factor that can be at play in terms of reduced fertility, and this is good news because these are reversible causes, would be things like excessive alcohol consumption. So if you're finding it difficult to conceive, we'd recommend that you cut down or stop drinking just for a month or so around the time before you conceive. This may help. Very heavy smoking of cigarettes may also be related. Excessive marijuana use, and of course excessive recreational drugs like cocaine or ecstasy would also be linked. On the other side, then we have exercise. Excessive exercise can also cause you to be underweight, but it can also increase the amount of stress hormones in your body like cortisol, and cortisol then can reduce the amount of estrogen in your body. So excessive exercise can also cause fertility problems. Of course, the opposite is true as well, and a lack of exercise leading to you being overweight, which I mentioned before, can also cause infertility. Unfortunately, for some women, none of the above factors play any role at all in the fact that she's having difficulty conceiving. And there are genetic conditions and factors that can be at play. So if you've outruled all the what we call reversible factors like lifestyle, smoking, alcohol, recreational drugs, you're retaining a good weight and you're exercising, and you feel that you're at an average age for conceiving and you still can't conceive, we would strongly recommend that you talk to our nurses for further advice and Let's Get Checked, or alternatively that you see your family doctor or gynecologist, as they may want to carry out more detailed tests and do a physical examination on you. So patients often ask me, how do you know if you're infertile? And a lot of couples will be impatient to have a baby, and they'll often say to me, I'm having fertility difficulties. And the first question we would say to them as a doctor is, how long have you been having unprotected sex for? So the rule generally is you need to be having unprotected sex for at least 6 months, but we actually generally in medicine say a year, but depending on the age of the patient. So if you're under the age of 30, we would be saying, look, you need to be having unprotected sex for a year, without conceiving in order to be diagnosed as infertile. Or if you're an older woman, we would recommend maybe 3 to 6 months. And if you still can't conceive after that, that's when we would advise you maybe to go to Let's Get Checked, talk to our nurses, look at our hormone test that we have to offer. One of our tests that we offer is a test called AMH, which looks at your ovarian reserve, or how many eggs you have in reserve. And that can be a very useful test for making future plans. So our nurses will help you decide what test is best designed for you.